No one goes into medicine to not be a good doctor. Nobody.
As a young clinician, I saw many things that I didn't know how to unpack. I called them my haunting cases.
I think a lot of people are really unaware of what medical ethics means and what we do.
At the center of it all is a human being in need of help.
I'm Renee McLeod-Sorgen, and I'm the director of the Division of Medical Ethics at Northwell Health. We started a division of medical ethics so that every patient could know that they had an ethicist, somebody on their side who's trained in medicine.
You know, people don't necessarily think of bioethics when they go to the hospital.
When we talk about ethics, we talk about how can we make a situation better.
Most of all, what we do is we try and help people with challenging decisions.
Adding a measure of compassion and thoughtfulness to the process of healthcare.
I think the Division of Medical Ethics provides an extra avenue of patient support, being an advocate for the patient.
It brings a level of care and experience to the table that other people don't necessarily see.
We provide 24/7 consultation service to the system. We're available to the hospital, to the clinical team, to the patients and families to assist with complex issues that come up.
It's very important to make sure that their feelings and values are expressed in the way that we take care of them.
Medical ethics cuts across every single domain in medicine.
Anybody who's practiced medicine for any period of time and been in a complex medical situation understands the critical value for world-class, timely ethics consults. A lot of times people get confused and think that, well, the ethics consult is coming in to sort of tell me what to do. But it's exactly the opposite. It's there framing the situation, making sure you understand all the ethical principles that are involved, and then you make your own decision.
All decisions in regard to the patient should be made by the patient.
My uncle is a very proud U.S. Marine veteran. Recently, he was in the hospital, very critically ill. He was placed on a ventilator, and you could just see the hopelessness in his eyes. But we were all preparing to say goodbye. That's when I reached out to medical ethics for assistance. They were able to allow for greater communication between my uncle and the clinical team, helping my uncle make his own decisions, to let him know that he was not hopeless. There was a next step for him, and that he was in control. And that was a tremendous part of his recovery. And so we are just tremendously grateful.
The Division of Medical Ethics has 4 arms, and the most important arm is patient care. The other arms are research, reaching out to communities, and education.
We serve as educators for clinical staff, whether they be physicians, residents, fellows, nurses.
Medical ethics helps all of the residency program directors create curriculum that's specific for the sort of clinical team that they have. And with the funding of generous donors, we are able to have 2 ethics fellows.
The fellowship in clinical ethics is a unique opportunity with the Northwell system.
I learned a lot during my medical ethics fellowship, bringing that compassion in with the critical thinking.
The bioethics certificate course was a great introduction to medical ethics. The certificate course gave me a framework to continue to evaluate what I do every day.
And I'm proud to say during COVID, we had 119 different clinicians, nurses, physicians, chaplains, that we had trained through that bioethics certificate course that did outreach to the over 300,000 patients that we treated during the first COVID surge.
Not every hospital, certainly not every health system, is fortunate to have specialists in medical ethics.
The entire division, when we created the division some 11, 12 years ago, was 3 people. We now are 10 ethicists strong, outreaching to 23 hospitals.
This division adds so much to Northwell.
Having a non-judgmental group of people who can sort things out and make things calmer and better is just a remarkable help in the way care is delivered. In the end, it really comes down to you put the patient first.
To be able to just have someone you can call to help when you're in a crisis is invaluable.
I really do love what I do.
It's changed how I view the profession of medicine.
I feel like I make a difference.
As an ethicist, my most rewarding part of this work for me every day is a patient. Every single day.